When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by ELISA just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at Mile 18 Bomaka. In Douala, you can find us at Bonaberry, precisely at Entree Pilote. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Welcome and nice to see you this weekend. It's a little bit raining outside. We're going to discuss something new, and we're going to discuss with you also something that is we all subject to, even though we have discussed it before, but it seems like it is very much repeating. You know, we see a lot of cases with what they call palpitation, especially in young ladies. Palpitation, the patient will come and complain about racing heart rate. And when you see the patient, the heart rate is normal. So the patient will explain to you that, I feel like my heart is jumping out of my chest. This is how bad it is. The heart is bouncing too bad in the chest. Sometimes you sweat. And especially in young people, right? Especially young ladies. You have fear, you have an anxiety, and the heart is just bouncing off. So, in this case, when you go to a clinic with this scenario or a hospital, what they will do? They will refer you to a cardiologist because you're complaining about your heart. So, they do the ECG, they do the echocardio, you spend a lot of money. And at the end of the day, they tell you, listen, everything is normal. There is nothing wrong. And believe me, this is a very common scenario. So we're going to discuss in the next few minutes what's happening there. You know, again, you feel palpitation that's on and off. At times you are fine. Other times you feel palpitation, you feel like you're afraid, you feel like you're anxious, but you don't know the reason. There is no reason. And sometimes this palpitation can wake you up from sleep. So it is bad. In medicine, we call that panic attacks. Panic attacks. And it is a form of an anxiety. Now we will go in depth a bit. We will go in depth a bit. An anxiety is worrying all the times for no reason. You just worry all the times. About the smallest thing, you start to get worried. You're emotionally vulnerable. Small things make you very emotional. Emotional response varies from one person to another. And let me tell you something. You know, the most common reason for those who get heart attack, if you analyze their personality, you know, you'll find out that those who are emotionally sensitive, they react to all emotion severely. Those are the ones that are most likely vulnerable to heart attacks. Real heart attack, not just panic attack, no, real heart attack. So, can we control our emotion? It's difficult. So, when we categorize people, those who are emotionally sensitive, emotionally, and severely responsive to different emotions are the ones who are at very high risk to get a heart attack. But those who, play it cool, they don't get bothered much with emotions. Those are the ones that have very low risk to develop heart attack. So when we talk about panic attack, yes, it could be cardiology, it could be heart problem, but in a young lady or a young man, and mostly young ladies, when we have this repeated all the times, and you go to do the ECG and you check your heart and the heart is absolutely normal, you don't have a problem, then this is a different diagnosis. In medicine, we call it panic attacks. Psychiatrists like to call it panic attacks. But we never really ask ourselves, what causes the panic attack? Yes, you put a terminology on it. You said it's panic attack, and that's what we teach our young doctors. Listen, it's called panic attack. When there is no cardiology behind it, where there is no heart problem behind it, we just call it panic attack. But what causes the panic attack? It's the the fear of the unknown. You're just afraid. It just happened. This is when medicine failed to explain certain phenomena or certain disease. They just blame it on something that does not really make sense. An anxiety, fear of the unknown. You're afraid, that's why you're anxious. But why? What triggered that fear? Should be the most logical question, no? Why are you getting afraid? Why not all people getting afraid? Why only certain people getting afraid and they have fear and they develop the panic attack, but others don't? Medicine explains it so people think that doctors are smart. But the reality of it is much deeper than that. Most of the patients, see, in medicine, we observe and we document and we see. So I have noticed the following. Those who are spiritually vulnerable, those who have spiritual problems, are high risk to develop panic attacks. So in medicine, we call it panic attack, but if you look deeper into what triggered this panic attack, you will find out it is not really the panic attack itself. It is not the panic attack, rather, it is a spiritual attack. And there is a spiritual cause for it. When I say spiritual cause for it, that means there are entities that you do not see that have triggered this attack. And that is the most logical explanation for a spiritual, or what we call in medicine, panic attack. It is no such a thing as panic attack without a cause. Everything that happened has to have a reason. And when we fail to find a reason, we just blame it into something else and we put a fancy medical term on it. Okay, so we talked about panic attack and the reality of panic attack and what doctors call panic attacks as panic attacks because they have no other explanation. Panic meaning you're extremely afraid. You're extremely afraid attack. That's what the medical definition is. And they say, it has physiological evidence. You have physical evidence, which is the tachycardia, which is the very increased racing heart, the diaphoresis, which is the sweating sometimes, and you just feel like, you don't belong to yourself. You feel like you're gonna die. You feel this is the end of your life right there at this point. And medicine calls it panic attack. But again, to repeat myself one more time, there is a reason for everything. And there is no such a thing as panic attack without a reason. It doesn't exist. Only when we fail, we say it's panic attack because of another form of an anxiety. You're stressed out, thus we get the panic attack. It is not the truth. If we look, how do we know? Because, as a practicing physician for many years, we get these patients, this is my specialty, we get this kind of patients all the times. They go to cardiologists say everything is okay. They do echo, everything is okay. They do ECG, everything is okay. So there is no medical reason that the heart has a problem. So that is why, by accident, okay, go to the psychiatrist then, or the neurologist or somebody who knows about nerves. And then they come to us. And then we find out that actually it's a panic attack. But how can you explain a panic attack? You cannot explain it. it's just the extreme form of an anxiety. Okay, but this is not enough to know why we're having panic attack. Because once we know why we're having panic attack, we can treat the problem at its roots. And that's what we're supposed to do. So again, I repeat, panic attack is nothing but a spiritual attack, believe it or not. Yes, panic attack is nothing but a spiritual attack. There is no panic attack without a cause. Okay? When we say an anxiety, why are you anxious? Because, well, you know, they explain it, or maybe it's a low state of serotonin. Serotonin is a neurotransmitter in the brain. When it's less, it causes a bit of depression, it causes a bit of anxiety, it causes a bit of insomnia, a lot of other, you know, psychiatric and medical conditions. And we call it low state of serotonin. Why? Because when they seen these people and they did some lab investigation and they measure serotonin, they find out it's low. But at some other points, some other times for the same patient, you'll find it high. So how you explain that? It's only that you have chosen to choose what fits your diagnosis and fits your medical terminology, ignoring the real fact that this serotonin sometimes can go up. How you explain it? You cannot. So, medicine doesn't know spirituality. It doesn't. Doctors were not trained for that. It's your observation during the course of, and your experience, your own experience, the experience you go with patients, and whether it works or not. You have gone through a couple of experiments, couple of experiences, and you did few things spiritually, and it works, and the patient recover. And now we know. We document case after a case after a case, and it becomes now an observation that has been documented by studies, and the studies are valid because the patient have gotten improvement without the need for different medication. You know, when we deal with head medication, it has a very bad side effect. If we do antidepressant, you know what is the major side effect of antidepressant? It causes impotence. Yes, if you're depressed, you know, and we give you antidepressant, you know, it can cause sexual dysfunction, men and women. So would you rather be depressed and sexually fine, or anti-depressed, not depressed, and you're impotent? It's a very tricky question. Yet we have in medicine, we have some kind of antidepressant that can treat you without the side effect of sexual dysfunction. But then again, why are we depressed? Oh, again, the studies have shown that low state of serotonin. But depressed people have always negative thoughts. Why we having negative thoughts? Oh, because this is how they are. We cannot explain that medically, why we having negative thoughts. We're related to the decreased state of serotonin. But that is not the truth. This is just doctors' way out of explaining things that they cannot understand. That's what it is. That's the truth of it. So the more, actually, let me share with you a story, okay? And I have this patient that came in, cannot talk. That was like a month and a half ago. The patient cannot talk for the last 5-6 days. He will not say a word. Previously, he was walking, talking, functioning absolutely fine. He comes to me, he cannot walk. He comes to me with a group of his friends. Patient cannot talk. We tried everything, cannot talk. We took him to a hospital, cannot talk. We did MRI, is nothing wrong. We did CT scan, is nothing wrong. We did all serology, hematology, every kind of medical test that can relate to the problem, cannot talk. We did fibroscope to go inside to look at the vocal cords, cannot talk. We give medication, patient cannot talk. Anti-inflammatory, steroids, strong steroids, injectables, by mouth, by every patient cannot talk. Patient does not talk. And he's been like this for almost a week. I didn't video document this case, but I documented another case that I'm going to share with you and show you. I spent an hour with the patient. Spiritual session. The patient talked. And the nurses was, wow, he talked. Yeah, he talked just like he was talking before. was no fault medically, MRI was absolutely clean, vocal cords, and this patient will be subject to a lot of anti-inflammatories, a lot of drugs, thinking that it's a medical cause. It is not. You know, sometimes when we do not want to talk about the spiritually induced diseases, we say, oh, it's psychogenic. That is the escape word to say that there is no spiritual disorder, it is psychogenic. This patient cannot be talking, is not talking because it's psychogenic disorder, meaning is induced from the head. It's possible. Yes, it's a reality, it's possible. But it is not the case. It is not the case. For those who understand the spiritual, and they can see beyond and see the reason and remove the reason and the cause, they will understand what I'm talking about. For the most of us here, that we do not believe what we cannot see, then it's difficult to understand. But it doesn't make it unexisting. It is existing.